There's also a lot of this misinformation too. Like we have people that come in the office and they're like, I'm 40. My doctor told me I couldn't get pregnant. How did I get pregnant? Well, your doctor should have never told you that.
Yeah.
Or I'm on testosterone. I'm a trans male. I can't get any, but I can't get pregnant. Well, you actually can. You also need birth control.
Yeah.
Right. So. It's an enormous responsibility to be pregnant and bring a child into the world. It's easy to get pregnant. It's not easy to continue and then to be to parent.
Yeah.
Right. There's getting pregnant and being pregnant, and then there's parenting. They're very, very different things.
Hey, it's another day where we are live, and so is public health. I'm Jonathan Lyle Sexton. Welcome to Better Together. Today, we are talking about family planning. There are many forms and shapes that this can take. It can look like maternal health, child health, infertility services, sexual and reproductive health, education, and so much more. The conversation over the years has narrowed in on some of these more than others, and our guests today look at all of them from a 30,000-foot perspective and a day-to-day perspective. They want to make sure that the humanity that their patients deserve is received and validated every day at their office. So here's my conversation with today's guests. Today we are joined by two guests. Jinelle Hall is the executive director of Equality Health Center in Concord, a nonprofit that's been quietly and persistently providing reproductive and sexual health care along with countless other services since 1974, back when it was called the Feminist Health Center. Before Equality Health Center, Jinelle spent the last 40 years in the nonprofit sector. She ranged from leading the Salem Animal Rescue League to helping write legislation as a lobbyist in the state of Illinois for the Dry Cleaning and Laundry Institute, which is so funny to me. I have so many questions on that. But in Rockingham County, she has a history of working with the Aging and Disability Resource Center, formerly known as ServiceLink. So shout out to our team here. And however you look at it, her whole career has been helping people who need it, regardless of how complicated the paperwork, regardless of their background. I'm also joined with the practice manager for Equality Health Center, Sarah Anderson. Sarah has been working in family planning for over 2 decades, since 1995. So that's three decades now. And she stuck through more changes in this field than leaves in a tree in autumn. It's awesome that she's here still fighting through the ups and downs to help people. For the last 5 years, this whole clinic has been operated without a dime of state or federal funding, which is amazing. And yet they're still here, still standing, still seeing patients, and still providing life-saving, life-changing work. Thank you all for being here.
Thank you for having us.
We're so excited to have you. And you want to just start out by telling us a little bit of the many things Equality Health Center does and who you are?
Of course. And thank you for that introduction. I would like to say, excuse me, when the doors opened in 1974, we were the New Hampshire Women's Health Services, right? We've gone through several name changes. And then shortly after that, we were the Concord Feminist Health Center, which we still are. And now we're doing business as Equality Health Center. So 52 years. And some name changes within those 52 years to go around the community members that we serve to really focus on opening up to other populations. So it wasn't just women, right? So
what all are some of those services you offer?
We have a behavioral therapist. So that's been since 2016.
Okay.
But we do transgender health care, menopause care, miscarriage management, birth control, STI testing, PrEP medication, annual exams, breast checks, all forms of contraception, abortion care. So it really runs the gamut from all sexual and reproductive health care, both for men, women, cis men and cis women, transgender health care, et cetera.
How have things been going for you, the services you can offer, the clients you see? And you said the community comes in and supports you with the support you need. So what trajectory do you guys see yourself on now after that pivot?
I mean, we just keep doing the services we do. I mean, we haven't stopped any services. And if anything, we're continually looking at what are the needs of our population in New Hampshire and surrounding states, because we do have people come from other states to seek care with us. A lot of border, the way we're tucked in here. So we're kind of constantly looking at what else can we offer, but we haven't had to stop any services. And I think that was one of the most important things was there has to be a way to continue with these services. So we've always had a sliding fee scale. So people who are uninsured or don't want to use their insurance, let's say for privacy reasons, or they're on a parent's insurance, that kind of thing. We've always tried to keep that low so that we're not turning people away. And we also get grants and funds that help supplement when somebody can't pay.
Some conversation I had with Jinelle at some point in time, you were talking about how you still have to run a business. Even though you get to offer so many of these services, you lost all that federal funding, but there's still the bills to pay, there's still the staff to pay, there's still the care and the services you have to offer. Well, not have to, but you get to offer to the clients that you have. How does that look in your day-to-day role of making sure that ends meet, even though you could have clients and patients come in who can't pay anything for the care, right? What does that look like from the business end?
So the business end, and again, we struggled, full transparency in 2022. We were, our budget was really, really tight. Mm-hmm. And looking at that budget and looking at that bottom line and talking to the team of what can we do, talking to the board, what can we do now? These are the things we can do now. So, and that was the focus. But again, without those funds and without those immediate revenues coming in, the full energy went with the clinical team of setting appointments, getting folks in. You also have to remember family planning really impacted folks in rural parts of the area in particular, right? And different maternity wards are closing. And so there's less and less services close by folks, right? So we embraced that. We were able to figure out we're going to get folks here. There's so many factors and facets and components to this health center.
There's the most important sense I get from you all is that it's a patient-centered practice. Everything comes down to what do they need, what can you offer, and how can you get them the services. No matter if they can afford to pay, if they have insurance, nothing matters except what do they need and how can you serve them in the way they need. And that's awesome. That's something that in healthcare right now, there's a distrust from the population, from the public to hospitals and other healthcare providers, health clinics, stuff like that you need someone such as yourselves who are very focused on the patients because the public has a large perception. We see it here in public health of everything's just about insurance dollars. Everything's just about the money that can be made. But then to have you here just saying, no matter what comes our way, I'm going to jump in head first. I'm going to make sure that our services can still be offered without being able to cut anything. As you mentioned earlier, nothing has changed. And how does your day-to-day look with having so many different services? Like, I'm sure you see a wide swath of patients within an hour that all come in for different needs. Like, what does that day-to-day even look like for a center like yourself?
Well, we've got our behavioral therapist who has patients, and there's some telehealth and some in-office, and then we have our nurse practitioner, and then we also have an RN, who's been with us for about a year, and previously it was just the nurse practitioner. We didn't have the RN. So we've been able to actually have the RN see some patients at the same time that the nurse practitioner does. But one of the things we also do, and I think why people like us, is that we're not cramming a bunch of people into an hour.
Yeah.
There's no appointment that's less than a half an hour.
Oh my gosh. Which is awesome.
And a lot of them are 45. And it's because it's not just one issue. If you're coming in for your annual exam, we also want to do a breast exam. We want to talk to you about your wellness. If you're coming in for birth control, but it's not just about birth control. It's like, what else do you need to help you be successful in taking that pill every day, right? So the idea that it's so singular, I think, is what happens in mainstream medicine. But we know from our patients is that everyone's life is complex. And this one thing that they're coming in for isn't in isolation. And so we want there to be enough time to spend with them. And so over the course of the day, we might see anywhere from 10 to 16 people. between the nurse or the lab and the nurse practitioner. So it can vary, but it's anything from somebody who wants to start hormones to somebody with an annual exam to STI testing, PrEP medication to prevent HIV infection. Right, we really run the gamut all day long, and so it's never uninteresting. We have great loyal patients who really, if they could do more with us, they would, right? Because they'll come in and say, I wish my PCP helped me with this like you do. I wish I could come to you for primary care. I wish, right? So I wish my other providers in my life explained this in such detail. So it's a collaborative relationship. Lauren isn't just the provider telling the patient what to do. It's collaborative. It's informed consent.
Yeah.
And so it's a lot of teamwork. It's a lot of teamwork.
I really appreciate that because I think to like my standard provider appointments and you go in, you sit there, you're waiting for a while, all for a doctor to come in and see you for 15 minutes and trying to kind of hurry up that process, asking you, okay, what's immediate right now? And then like, okay, we'll take care of your labs and I'll message you responses, right? There's not that 30 minutes, talk to me. Okay, we're going to put you on birth control medication. So let's make sure that you're successful in taking that, right? Let's make sure that every other part of your life, you're not making risky moves that might affect you being able to go and have these contraceptives available to yourself, right? Like it is a full look at their care, what they need. And I think that's absolutely awesome.
We want them to be successful.
Right.
Yeah.
Right? Like we're not going to, we want somebody to be successful. So.
Exactly.
And we have the human touch. Our organization, our little health center, this powerful little health center, we answer the phone live. Right? You come into the building for your appointment, you're talking to a person. You're not punching your last name into a screen, right? So it's that personal touch for folks, too. And our facility is very unique in itself and comforting to our patients. So I think I'm proud of a lot of things with the organization, but just having a live person answer the phone when you're calling your provider.
We don't have a call center. We have no interest in doing that. It's really like, how can we help you?
Kind of pivoting a little bit away from like organization level to just like family planning in general did either of you grow up in New Hampshire? I did not. You did.
I did.
So over your course of time from when you were maybe in school to now, what has family planning meant to you? What did you maybe learn about in middle school, high school that prepared you for getting out into the real world? Or what do you wish was different? And where are we now?
Well, I remember my 5th grade video when they separated the girls and the boys. And talked about, right? And all of that went out the window when I finally came of age. I was like, I don't know what's going to go. I have to say, it was crickets, right?
Yeah.
I mean, you really had in the 80s, you had to seek out the information, a lot of it on your own, unless you happen to have a family or parents that were like, let me tell you all about this, right? But I have to say the most pivotal thing was Obamacare. Because it made it put contraception under preventative medicine, and people didn't have to go use their deductibles. Contraception didn't go to deductibles. And all of a sudden, you can get an IUD without having to pay $500. The access was remarkable.
Yeah.
Was remarkable. And there are still a lot of people that come in and be like, I didn't even know I had all these birth control options. It's like, where? So the teaching we know isn't really happening in schools because now a parent doesn't like that there was a class about it. And so now there's a lot of different dynamics. I think before they were like, we're not going to talk about it. And then they wanted to talk about it. Now we don't want to talk about it again. But the fact that people can get it without forking over a lot of money, or if any at all, has made a massive, massive change. Medically, family planning is the ability to control if and when you get pregnant and have a child, and the spacing between those childbirth so that your body is healthy, right? There's a financial side to it, of family planning dollars and funds, and then there's the medical side. And that has been so important. That was the biggest shift.
Oh, I bet. I grew up in Idaho, so our family planning was crickets. This was back in early 2000s, 2010s, and it was until college I learned what an IUD was. And like I knew birth control from TV shows, right? Of the, oh crap, I forgot to take my birth control, right? There was so many things that I had some idea of, but it wasn't until college when like people started talking about it more openly. Like that's when I really started understanding all these different options and avenues available. But I really appreciate that you just gave like the medical definition of this is what family planning is, and really kind of solidifying that family planning is similar to public health. It can be a very encompassing word. There are a lot of things that fall within that care and that service, right? What are the real life consequences for maybe some of your patients or something if the family planning is missed, right? When you either rush too quickly into being pregnant again, you don't have some of these just educational pieces that you might not have the economic support to raise a family and start a family. You might, right? There's so many different aspects we could go into, but what are some of those real life, I don't know if consequences is the right word, but like real life. Yeah. There's fallout. Fallout, there we go.
To anything, right? Certainly unintended pregnancy, right? You can do your darndest to do everything right and still end up pregnant because when you don't want to be, because nothing's 100%. And pregnancy can be very complicated. Pregnancy is very hard on the body. So the idea of not spacing them out, right? The body needs to recover. So there are physical things that somebody has to consider when they're thinking about being pregnant or not being pregnant. There's also a lot of this misinformation too. Like we have people that come in the office and they're like, I'm 40. My doctor told me I couldn't get pregnant. How did I get pregnant? Well, your doctor should have never told you that.
Yeah.
Or I'm on testosterone. I'm a trans male. I can't get I can't get pregnant. Well, you actually can. You also need birth control, right? So it's an enormous responsibility to be pregnant and bring a child into the world. It's easy to get pregnant. It's not easy to continue and then to parent. Yeah, right. There's getting pregnant and being pregnant, and then there's parenting. They're very, very different things. We do a lot of birth control counseling. So, these are your options. What would be best for you? What are your biggest concerns about your birth control? What do you think would make you most successful with your birth control method? Like, we spend a lot of time talking about that. Education is a key piece. Yeah. And a lot of people, I didn't know that. I didn't know that. I didn't think I had to consider that, right? And when somebody can come in and learn and be really empowered and feel really confident in their decision making, that's great. Yeah. That's really important because it will trickle into every aspect of their life,
Yeah.
And making sure folks know of the services, right? The breast and cervical cancer screening program that we have with the Department of Health and Human Services is a tremendous program. And I will say in the last year, we've had 3 folks come in, younger folks come in, and due to their screening, early detection, cancer detection, right? And currently in treatment. Yeah. And it was because of this program. Right? And folks aren't aware of that. So again, it's getting that information out. And Sarah and I are, we obviously work very closely together, but looking at the future and what are the needs? Let's do a needs assessment. What do folks need? What are folks asking for? And how do we get that information out to them? And you know what? We as an organization is going to help us grow, right? And be able to continue to serve the population we serve. But it's really looking at the entire family planning picture, right? Because there are so many pieces of it. Whether you're talking pregnancy, whether you're talking even we don't offer vasectomy services today or yet, right? But it all encompasses, right?
Yeah.
You need to be a full service organization. In the behavioral health program that Sarah spoke to, that's been six or 7 years.
Was
oh my gosh,
the inception.
Wow.
Yeah.
10 years. And it's needed. I wish we could clone our behavioral health person, right? Because the schedule is chock full, and we need more providers, more clinicians to be able to grow, right? To be able to serve every person that's giving us a phone call. We get them in, but we're there 5 days a week, and maybe we'll open Saturdays at some point. But
when talking about misinformation, if you could just go out into the world, if you, for instance, had a microphone, what's one piece that you would like to correct? Not specifically about Equality Health Center, right? But what's that one piece that you wish everybody could kind of just flip on
about equality?
I will. Yeah. I have one equality. I will say, and I said it earlier. While our history and our founding mothers went through the gamut of opening our health center, we are more than an abortion center. We do so much more. And how do we get that message to folks, right? And we are investing. We just recently, we're investing in a digital marketing campaign and with a company and a board of directors and a team member. It's a collaborative effort, right? And to help us get our messaging out to areas. I am not a social media person, right? I'm not going to date myself, but Facebook is not for me. Is TikTok, all of that. But we just created a TikTok. We have wonderful summer interns, amazing summer interns. They created the TikTok. They just recreated all of our merchandise on Bonfire.
That's awesome.
And it's incredible because it encompasses our 1974 beginning stages to now. They brought in artwork. And it's amazing. So back to, if I could shout, we are not just an abortion center. We are so much. We are that and more.
When you look at all the other life-saving work that y'all do and all the other services and care that you can offer people to make a little effect in their life, to just better it, right? We're here for 70, 80 years, right? How can we live the best life we can, right? How can we live those 70 to 80 years and be happy? Not have to worry about everybody else's thoughts, but just truly be happy with who we are, what we do, and enjoy the 24 hours a day, 7 days a week, 365, 70, 80. We're lucky, 100 and 200
really
years.
A judgment-free zone.
Right.
I mean, we want you to tell us everything so we can best serve you. We're not going to judge you. We're not going to disown you. We're not, right? Like, this is the place that you can actually come and say everything.
Yeah.
And we're going to figure out how to prioritize your care. Just, what needs what first. And we're going to do it in a way that you can come back and say anything to us again, and we're going to help you. I mean, I think that's the most important thing. I don't want to go to my PCP because they're going to judge me. Right? We hear a lot of that.
Yeah.
Like, I don't want to go to my primary care for this issue, even though I could, because this is how I feel when I come in the door here.
Yeah.
That is crucial. That just makes everything. I think that's, we talk about burnout and we talk about, we're a small team, we're all extended and doing everything, but it's such a reciprocal relationship. It really is a lot of teamwork. And I think, not everybody approaches their healthcare like, I've got to be a team, I've got to be on this team with my provider. But we do try to promote that because everybody does kind of need to do their part, right?
Yeah.
But it's invigorating.
I love the judgment-free zone, right?
It's crucial.
We just talked about it in our last season with Daniel Amato from Merrimack Valley Assistance Program about just that, especially with AIDS, HIV. There is a lot of stigma. There's a lot of judgment around those two things that people don't feel comfortable going to their primary care physician. They don't want to, but having a space where you feel like, okay, I can come to them with my problem, get the help I need, get the assistance I need, That's so crucial. And Sarah, did you have another piece of misinformation that you wish you could just scream?
Well, I was just thinking about it. When you talked about HIV, that is, for most people coming in to do STI testing, the scariest part of it is they're like, I don't want an HIV result. When in actuality, that's their least likely infection to have.
Yeah.
You're more likely to have chlamydia. You're more likely to have gonorrhea. You're more likely to have trich, right? So there are these big, scary, it used to be that HIV was a scary death sentence, right? And we have come so far in HIV and AIDS awareness and treatment. And so it's not the same anymore.
Yeah.
But it still has this stigma of like, oh my God, this is the worst, right? When in actuality, they're more likely to have something else.
Yeah. Right.
That we can treat. There's a lot of shame still associated with STI infection, when in fact it's just really, really common.
Yeah.
It's really common. And we have people that come in regularly just for testing. It doesn't matter whether they're active or not. They just know every 3 months they want to know their status, right? But so I think one of those, that's one of those misinformations is just education related.
Yeah.
I think that's ultimately what it is. It's that STIs are common. There's no shame in it. We can treat it. And come get tested.
I love that.
Open conversations.
Please. Yeah.
Open conversations.
Yeah.
We go, we've attended some colleges, like UNH has a Sexpo, and we'll be up at Plymouth Pride, and it's just the stigma. We've got to get rid of that, right? It's just talking about things and not being afraid to say, oh, chlamydia, or, it's wild. It's wild.
I think the other thing that we provide too, you can go to urgent care or convenient MD and do STI testing. They're not going to do throat or rectal swabs. Your PCP can do STI testing, but they're not necessarily going to do throat or rectal swabs. You can have chlamydia in your body, somewhere you have sex, that's not going to show up in your urine, right? So we're really clear about like three site testing.
Yeah.
Where you have sex is where you need to test. Let's do that. And that is not something you can get at a lot of other health centers or even your primary care office. So even that education, like, I figured if I did a urine test,
I was good.
Like chlamydia is chlamydia.
Yeah.
It's somewhere in my body. It's going to show up in my urine. But that's not the case.
No.
Yeah.
Part of the education.
So part of the education really
100%.
is. I love it when people are like, I didn't know that.
I didn't know that.
Isn't that great? Yeah.
I think education is always such a key piece to everything, and it's the hardest thing right now. Right? Figuring out how to communicate in an environment where everything is, you have 30 seconds, right? 60 seconds to tell everybody everything they need to know.
Before they swipe.
Exactly. Right. We struggle with that. We just went from our podcast lasting close to an hour to cutting it back to 30 minutes because people were only watching 10 minutes of it, right? But there's so much information, so many conversations that we get to have that it takes that conversation. It takes that openness. It takes that setting the stigma aside and just saying, let's have a real conversation about what's going on. Not being hesitant, not being afraid, but just saying, let's have this conversation. And because it's going to open eyes. It's going to make people feel like, oh, I didn't know that. And totally shift how they think about it, right? You're going to learn about services when you have those conversations that you didn't know were available to you or that you should even be thinking about asking. Right? I didn't know if I should be asking my PCP about STI, STD testing and like how they would go about it and what they feel like for who I am. Right? It's absolutely fascinating to just kind of think about those things in a new light. And that doesn't happen without these conversations. And if someone wanted to get in contact with your organization, get involved in any way, any great ways to contact y'all?
Several ways. We have, the website, right? We have info at equality, hc.org, right? Our email. The phone number is 603-225-2739. And the other thing I just want to add to this is,
please do.
We talk about the team and talk about our services and being inside the building.
Yeah.
This team, we also go outside the building, right? We are outside at the State House. We are outside at Pride events. We are in the community, right? So folks also see us. We're visible to folks, right? And we went as a team. We walked down to the State House this past year for a piece of legislation. It was all very important, but this particular one. And we went down as a team, right? We were able to carve out that 40 minutes in the morning before clinic opened, before our first patient, and we were visible to folks. And I think that's important.
That's huge.
Trans Day of Remembrance, our team members are there.
Yeah.
Right? So outside of the work in the building, there's also work outside of the building, and for us to be visible and accessible to folks. It's incredible work. And I know for myself, this has been one of the most rewarding jobs I have held. And the team, coming into this team has just been knowing that they've got it. They're seeing the patients, they're doing the work, and like Sarah said, I'm outside doing the other work, right? It's just, but we figure it out. We always figure every obstacle that comes our way. I'm not saying it's easy, and we've had many hard conversations as an organization, but we're here.
Yeah.
52 years later. We're going to be here 52 years from now, right? Where we jokingly say our daughters are going to be running the organization, right? Like the next generation is going to come in. So, yeah.
Well, thank you guys so much. Before we get you out of here, got a set of rapid fire questions.
Okay.
Y'all ready?
Here we go.
Okay. One word to describe your work.
Powerful.
Oh my God.
This is rapid fire.
I know, I'm not rapid fire. One word. Inspiring.
Inspiring, powerful. Okay. Best place in New Hampshire.
Concord. I don't know. There's so much. The mountains, the water. I mean, New Hampshire has it all, don't we?
Truly.
We have it all.
My daughter and I hike Georgiana Falls a lot. It's up in Lincoln, and it's a little like water. It's a waterfall, and there aren't many people who know about it. But I think the mountains.
Yeah,
okay.
We have it all, yeah.
It's just because it's quieter.
That's why my wife and I moved here. Yeah. Like, Concord is an hour away from everything.
It is.
And I'm glad that I get to come up to the Lakes region every day, see the lakes, see the water, get all of that as well as everything. Oh my gosh, I love it. If on a commute, podcast or playlist? You listen to music or you listen to podcasts? Playlist? And then
podcast.
Okay. One of each. I'm a podcast on a long drive, playlist on short.
My commute is like 0.2 of a mile, so I'm like, I can listen to one song on my way to work. On my way to work.
I have like 30 minutes, so I get like a nice, I get a podcast
I have
in
about
during
that, right.
commute, yeah. Go-to desk snack.
Oh, my big secrets.
I'm told I eat like all day long.
You
so
do.
what is my snack?
You do. But I guess it's my stress. Well, I have hard candy, right? That's for everybody. But my stress snack is I go down to the RN's office where she has Hershey Kisses.
Oh.
So, no, it gets better. I get that Hershey Kiss, and I usually have a jar of peanut butter in my office. So there's the spoon with the peanut butter, and I put the Kiss on it.
You just eat. That sounds really good.
That's my treat.
That's chocolate and peanut butter.
All my day's food surrounded on the desk next to me, and I'm just like, oh, I should eat.
She does. Before we came up here, she's like, hold on.
I gotta hold on.
Gotta grab this, gotta grab that.
But that's something else we do, right? We share food, we make food. Sarah is an incredible baker, right? Yeah, food brings us together. Absolutely. Even brings us more together as a team.
Campfire or front porch?
Oh,
for relaxing. Front porch? Like watching the world go by? Seeing everything happen?
Well, now I have to rethink that.
That's not a fair question.
Not a fair question?
It's not a fair question because
I know.
both.
They're both
Like
great.
my front porch faces like South Street in Concord. And there's a lot of traffic. I can't say that's very relaxing. So a campfire would be
It
nice.
depends on where the front porch is, right? If I'm on the front porch near White Park, different. If I'm at a campfire up north. The real answer is body of water. That's the most relaxing.
Lake or ocean.
Yeah,
I like
lake
that.
Or ocean,
I'm an ocean person too. I like a campfire for like a nice day for a night, and then all of our neighbors, we all like yell at each other from across the street. So that's the nice thing of the front porch.
Yeah.
We have our front porch is the size of this table.
Yeah.
So it's like we are standing. They all have nice sprawling porches, rockers on it, and my wife and I are just standing there, being like, "Hey,
come over."
from around a corner," and it's great. What's your favorite color?
Oh,
Blue.
Blue?
I say colors of the rainbow, but yellow, red. I like, there's.
You just like all the colors?
I'm a Gemini, okay? So it's like really hard to make a decision when you're asking me questions like that.
This is great then. Challenging Jinelle on the decision-making process.
Right? With these kinds of questions, it's very challenging. So, yeah.
Last question is, what gives you hope?
I will say what I'm teaching my daughters and what they're hearing and listening in their generation. I am hopeful for their generation and for them to be the voices of reason.
I am hopeful in all the grassroots efforts that just constantly keep springing up because people want to help make a change. And they're not looking to somebody else. Like, why aren't you doing it? They're like, I gotta take it on. I've got to take it on.
You've got to be in it.
Do it by myself, but I've got to participate in some capacity. And some days it feels like nobody's participating, and other days it's like, wow, there's so much that's blooming, that's blossoming here. Like, if that keeps going, we're going to be okay. There's going to be ups and downs, but that's motivating.
Yeah. So I always love that when you can see the people getting around a cause, getting around what they want to make change. And then that's so inspiring. So thank you all so much for your time.
Thank you.
You all have been amazing.
Thank you. So, thank you for allowing us to share our work with you.
Of course. So awesome. Thank you.
Thank you.
I want to thank Jinelle and Sarah for being a part of our conversation today. And it really reminded me how important it is to just have conversations without stigma and also be able to educate people on this thing that takes up so much of their lives. If you look at the grand scheme of the educational system, talking about family planning, sexual and reproductive health is maybe 0.0001% of everything you learn. Yet, being a parent, having kids, watching other people have kids, watching other people be parents, watching other people be pregnant, it is such an important part of our life that it shouldn't go so undereducated, but it does, and that's where we're at. But that's where people like Equality Health Center step in. They come in to help educate, to help provide the care and the services that each of their patient deserves and need. They really meet them on a human level and offer them exactly what each person needs in that moment. They meet the people where they're at. Subscribe and follow so you don't miss what's coming next. You can find us online at pphnh.org or on our socials at pphnh. If you're hesitant to know what the face saying these words looks like and you're just listening, go to YouTube. You should just see my lovely face. I mean, it looks great. So go online, check us out at pphnh on YouTube. Hit that subscribe button. It's free and it helps these conversations reach the people who need them. It really makes a difference for such a little action. Better Together is a partnership for public health production. It is produced by myself, Tessa, and Emma, which is why the set looks like my brain. Very cluttered, all over the place with random items. It is written by Jonathan Lyle Sexton, Emma Peterson, and there's technical direction from Tessa Donahue. Thanks for being here, and we'll see you next time.